They're a common requirement from many employers and schools when you're sick, a note from your doctor. But now the Canadian Medical Association says it's time for employers to do away with the need for those notes. Joining me now is the president of the Canadian Medical Association, Dr. Reimer. Doctor, good morning. Good to see you.
Morning. Thanks for having me.
Why is the CMA taking this position?
We really see this as a win for everybody. When we think about what Canadians experience when they're sick, let's say they have a cold or they have a migraine, the last thing that they want to do is go and see their doctor when they don't need medical care. What you really need to do is rest up at home and get better so you can get back to work. But we also know that there's 6.5 million Canadians who don't have access to a family doctor. And when we see that sick notes are taking up millions of hours of family doctors' time, this is something that's causing that to become worse. And so we want to make sure that our family doctors are available to Canadians to provide the care that Canadians need and Canadians deserve. And so if we can get rid of something that really has no medical benefit to anybody, but does add to the workload that family doctors are experiencing, that's a real win for all of us.
Does the ongoing shortage of family doctors just add to the stress on doctors of getting those notes? And I know in a lot of situations, you have to actually make a doctor's appointment to get that note. You can't just call in and ask for it to be sent over.
Well, we know that a lot of our physicians, in fact, the majority are telling us that they're experiencing symptoms of burnout. And the amount of paperwork they do, which is somewhere between 10 to 19 hours a week, is a big part of that. And sick notes are part of that as well. And when it's paperwork like sick notes, where there's no medical benefit, where you're not providing any of your expertise, those are particularly frustrating for physicians and for patients as well. And also, we don't want people who are sick coming into to our waiting rooms, spreading viruses. We don't want them going to work just because they can't get a sick note and spreading the virus in their workplace. So it's really important that we think about how do we best use family doctors? How do we best use our medical system and let the human resource problems be solved with things like self-attestation forms or more flexible leave policies?
How do you get employers on board with this idea?
We really don't think that there's a major benefit to this current setup for employers either. One of the things we see is that people often come and see us after they're already better. So if they have a migraine, for example, they might come the next day to see us and get something filled out. And really, as a physician, there's no way for me to objectively determine whether or not that person had a migraine. So I'm giving them a medical certificate saying they told me they had a headache. That's all I know. But if indeed there is concerns from that employer about that employee misusing their sick leave policy, they now have a medical note saying that they were legitimate. And so it can actually make things harder for employers. The other issue, like I said, is that 82% of people surveyed told us that they would rather go to work sick than go get a sick note. And that means they're going to be coming to work, spreading viruses, leading to other people being sick and being away from work. So it's actually going to be worse for the workplace if more employees end up being sick.
Isn't there a lost source of revenue though for doctors? I mean, many charge $50 for that note. We often are told that family medicine is run like a private practice, a private business, a small business. So is there a downside to getting rid of those notes? Does it eliminate a stream of revenue for doctors?
And that's actually a really hard thing for us to do when we have to charge a patient directly for a service. So this is something that's not covered by any of the provincial healthcare plans. And so when we do get paid for it, it's because that patient is paying us directly. And most of us hate doing that. And that's a really stressful thing and can really damage the patient physician relationship. So while some physicians do charge the patient and do get paid for those visits, if we saw a different patient in that same time, we would get paid by our province for that work instead. So most physicians would tell you they'd rather not get paid for unnecessary paperwork than get paid for unnecessary paperwork. So we just want to get rid of the unnecessary side because there's more than enough work for us to do, and we're still not meeting the needs of Canadians.
Dr. Reimer, thanks so much. Dr. Joss Reimer is the president of the Canadian Medical Association.